start? Is it on? Can you hear me?
No, no, no. Press to do.
It's on. All right, good morning, everyone. Thank you so much for coming. We are starting today, starting right now. So we are very excited here. We are the NRL team, the National Reference Laboratory, which is a division in the Rwanda Biomedical Center. And our focus for today is going to be on disease surveillance, drug monitoring, and quality assurance. So we apologize, our moderator had to attend to a very urgent matter, so I'm going to be moderating this session. So let me present myself. My name is Raissa Muvunyi, and I am the bioinformatics analyst at the National Reference Laboratory. And prior to this, I was research associate to the vice chancellor at the University of Global Health Equity. And prior to that, I was also doing some work with National Council for Science and Technology as a bioinformatics specialist. Today, I also have a team that's going to be presenting alongside with me. So I will ask everyone that I mentioned to stand up and present themselves here in front. I'll start with Esperance Umumararungu, who's the director of the Molecular and Genomics Unit at the National Reference Laboratory. Prior to her tenure at the Rwanda Biomedical Center, she played pivotal roles at the Rwanda Military Hospital, making significant contributions as a molecular biologist in the hospital's laboratory for 2 years. And she was serving as a research officer for an additional year and a half. Esperance holds a master's degree in molecular biology from the Pan-African University. Please come in front and present yourself. Please give her a hand of applause, please, for Esperance. Come stand here. Here, I think that's where you can see. Yes. All right, thank you so much, Esperance. Next, we have Emmanuel Kabarisa, who's the director of the Immunovirology Unit at the National Reference Laboratory. He was appointed in July 2023, and he has a robust background in biotechnology and genomics. Before assuming his new role, he served as the genomics omics specialist at RBC. His career trajectory includes serving as a lab biotechnologist for external quality control and quality assurance from a period of 10 years, and as a lab biotechnologist for molecular virology. Please come and stand here. So as well, thank you. Next, we have Dr. Noel Gahamanyi, who's the director of the microbiology unit at the National Reference Laboratory. Before joining RBC, he was also dedicated in 8 years for academia as a university lecturer of microbiology-related molecules at the University of Rwanda. His academic leadership extended to serving as the Vice Dean of the Faculty of Science and Technology at the Catholic University of Rwanda for 4 years. Dr. Gahamanyi also holds a PhD in molecular microbiology from the Sokomi University of Agriculture and an MSc in microbiology from Jayan University. Please come and stand. Thank you so much. Could you please clap for them? Thank you. Last, we have Etienne Kaiji, who's our OG, like we like to say. He's been with RBC since 2003. He has a rich background in laboratory science. He served for 11 years as a laboratory scientist prior to that at the King Faisal Hospital. And he has experience as a lab network specialist, lab network senior officer, and director of the unit currently. Thank you so much. Please come and stand here. So these are our panelists for today. Thank you. You may sit down. Thank you so much. You may sit down, yeah. All right. So, as I mentioned, we're going to be talking about the disease surveillance, drug monitoring, and quality assurance. And it's going to be focused with a lab perspective. So, if you could please have the slides. Heard. I can't see them. Oh, okay. So we're gonna have to wait for a little bit. But before we start, so we're the National Reference Laboratory, as I mentioned, and we're a division in the Biomedical Service Department. Next, please. Please bear with us for a little bit. It's lagging a bit. So we are, basically our role here at RBC is to provide accessible, quality laboratory services and to strengthen the national diagnostic network through leadership and expert guidance to reduce the burden of diseases in Rwanda and in the region. We also carry out a lot of activities with different laboratory facilities across the country. And we have 6 divisions, so we will see that we have seen 4 of us. So we have 6 divisions. We have the Lab Service Coordination and Quality Assurance Unit that is responsible for quality assurance and coordinating any lab services. We have the Microbiology Unit, which Dr. Gahamanyi leads. We also have the Immunovirology Unit, and we have the Molecular Genomics and Clinical Pathology Unit, as well as the Medical Entomology Unit. So this is briefly who we are, but we are not going to talk about who we are. We're going to talk about disease surveillance. So our topic for today, please go next. Next. Also, please let me know if I'm speaking fast. Yeah, all right. Next. I think you have to press next. There we go. All right, so our topic is going to be on laboratory coordinated surveillance using the SARS-CoV-2 variant tracking model. So let's refresh a bit our memory on SARS-CoV-2. I know it was a nightmare for some of you, but thank God we've passed that. But however, I would like to sort of set the tone and make you understand where we play a role in disease surveillance. So as you can see on this pyramid, when a person is infected, they have symptoms. Some of them may be asymptomatic or symptomatic. But what you want to get them to the clinician, but we first have to diagnose the person, make sure that we know what the person has. So this is where we lie, but we don't want them to reach a level where they die. So that's our first role as far as disease surveillance is concerned. Next, please. So our model, if we look at on the left, we are looking at what are how to sort of manage cases of COVID, and this was published by the World Health Organization. When we have a suspected case, we do a confirmatory test, and then the positive is followed up with looking through contact tracing and etc. But ours is different, where we're not looking at suspected cases. We're just taking what we call pooled samples, and then we're also taking wastewater samples, so we can identify the different variants. And we also can track where these variants are coming from. So our model's approach is to use NGS technology, which is next generation sequencing, to track variants of SARS-CoV-2 and prepare for any emergency threats that might be upcoming. Next, please. All right. So briefly, these are the cases of COVID, how they were reported, and as you can see, Africa had the lowest of in numbers of COVID-19 cases reported. However, we're not so much interested right now about COVID cases. We're more interested in what kind of COVID do we have? What kind of SARS-CoV-2 do we have? So next, please. It gives you time to look at the slides. Is it turning? All right. All right. So this is to show you also how Africa, the trend of COVID-19 over time. As you can see on the far top, we are looking at the peak. The second wave was it sort of continued to increase and then will go down and go up. But right now we're in a stage of like sort of we have more immunity. We have slowed down, so there's no more. There's not a lot of cases of COVID-19, and we have becoming better at managing COVID-19. So, because more people have also been vaccinated. So, yeah. Next, please. The question is, are we ready for any emergency threat? Here, I'm going to give you the case of Rwanda. As you can see, we didn't have many reported cases, but however, we want to be ready for any emergency. So we have acquired through our partners, we have acquired some new technology, which is next generation sequencing technology, such as Illumina. We have Illumina Minisec and NextSec. We also have the mini ion nanopore technologies. We are also trying to train our people to be able to do sequencing. Right now we're doing whole genome sequencing, but we want to continue to advance in other types of sequencing techniques. We also have a team of bioinformaticians that also are being trained so that we can analyze this data, this sequence data. And we also have storage capacity, but we want to be able to improve that, because storage capacity is of our sequence data is very, very crucial in terms of this work that we're doing. Please come and. So my colleague is going to take you through our new model and how we do that.